No class on tools and technology and devices would be complete without talking about pumping. We know as lactation professionals that you never need to pump to successfully breastfeed, but in our modern era, most people at some point in time will need to pump. So we're going to be talking from low tech pump tools and technology all the way through high tech, because using any technology, low tech or high tech, in the wrong way can actually cause damage. So I want to really talk through the process of all of the different technologies that are available out there, not necessarily every brand or every product, but every type and area of those tools and technologies. So when you're working with a family, you can analyze the tools that they're currently using to see, is this causing a problem? Can we use it to remedy a problem? Do we maybe need to change it for something else? So to start with, we're going to go as low tech as possible. Your milk collectors. These are passive milk collectors that would just sit in the bra. I like to call them boob donuts because they are usually a circular form with a hole cut in the middle. All different sizes, shapes of these passive collectors. These do not generate suction in them. Their goal is to sit inside of the bra to collect leaking milk that's passively leaking. All of these products are some kind of soft silicone. These two, the entire product is soft silicone. These two, the back that touches the breast is soft silicone, but the front is a hard plastic. Milk can collect in here. Some people leak a lot, some people don't leak at all. Be encouraging families that if they don't see leaking milk, it is not a concern. There's a wide range of normal in that. When you're looking at the back, they're also going to have different size and shape holes. So you want to be mindful that if you have a very large nipple, you're going to want to go with a hole that's a little larger. Now these, when they are tucked into the bra, they go into the bra, the nipple goes in the center hole, and then they're supposed to put the bra back on. If the bra or clothing is too tight, it can put pressure on that breast, which can cause the breast not to drain or empty well. It can cause swelling in the breast. So if a parent shows you a picture, they've got a plug duct, they think they have mastitis, ask about passive milk collectors. Do they wear one in the bra all the time? Do they wear it just during feedings? Because wearing one of these that too much or too long, where it's putting pressure on the breast, can absolutely cause issues to the breast. Ones that are a little firmer on the outside can be used as breast shells, again, to relieve pressure from the nipple. When it's healing, if a parent reports that the nipple is rubbing on their clothing, they don't like how it's touching clothing, these can be a great handy tool to pop in the bra while the nipple is being healed to keep it from sticking or touching fabric. So there's all kinds of different ones of these. I will note that this little one, the ladybug, has a little valve on top, because when you do press this on the breast, squeeze it and close the valve, you will generate a vacuum inside of there that can pull off more milk than would just naturally leak. Anytime you're creating a negative pressure inside of a product, you are increasing a vacuum, which will draw milk out of the breast more than if there's no pressure there. So also be cautious that some of these, when they're used like a vacuum, can put too much pressure on the breast. They can pull it in and cause swelling or cause pain because of the suction generated right around that areolar complex. So listen to the symptoms that patients are describing and then ask what tools they're using. The next ones are these silicone, I like to call them boob bombs, boob grenades. These are manual hand pumps. You'll hear them called silicone hand pumps. The most common brand is the Haka brand, but there's lots of brands out there. There's different sizes. This is a large 6-ounce size, very heavy for a lot of patients. This one is a 4-ounce size. It's a lot smaller. Patients basically flip it back like a cup. They would put it onto the breast, squeeze to get the air out, flip the collar, and then when they release, it will suction on to the breast. This can be used on the opposite breast, either pointed down to the side or pointed up. So if a kicky baby is knocking that off the parent. You can put them up because it suctions on. Trouble with these is too much suction can again pull and put damage on that nipple or areolar complex because you can cause it to swell. It would be a similar concept to cupping, if you've ever seen cupping as the manual therapy. So it's basically cupping that nipple, which can cause some bruising or swelling from it being too tight. These, though, have pros, cons to them. They collect leaking milk, but the harder you suction it, the more vacuum is inside of it, the more milk will not passively be pulled out, but actively be pulled out during feeding and leaking. There reaches a point where you hit that feedback loop with the breast where the more you empty, the more you'll make. So if a family is always using this and pulling off more than they would naturally leak, you're going to perpetuate a higher supply than that family may want. Too much use of this, I have seen cause an oversupply in patients that causes a forceful letdown. So I have also seen these where you're feeding the pump instead of the baby. So depending on supply, there's a lot of different ways it can go. It can create an oversupply. It can do just right and be a great tool to help collect leaking milk, or we can feed the product instead of feeding the baby. So again, listen for those symptoms. If you have a mother that's using this every single feeding and getting 1, 2, 3, 4, 5 ounces every feeding, the higher the number, the higher the supply. That could be an oversupply. Listen to other symptoms. Is the baby coughing or choking? Is the baby starting to have mucousy, frothy, foamy poops because they're getting a lot of water content from a high supply? Listen for, is the baby really hungry after feedings? Baby's not satisfied at the breast. Are we filling and feeding the product instead of filling and feeding the baby? Other strategies of how you could use this. A lot of parents will put the baby on one side and put the product on the other. What some parents will do is if we're feeding the product too much, you'd put the baby on, and when they switch sides, then put the product on. So again, these have risk benefits. They can do damage if they're not applied correctly. They can stimulate an oversupply. They can also underfeed the baby. Listen to how people are using those products. So those are kind of the low-tech products where there's not too much mechanically involved. The next step up are piston pumps. Medela has a piston pump. Every hospital I've worked at has always had these on the floor. This is the Hygeia version, and you can see they're almost identical. So how this works is there's 2 different ways you can use it. So the first way is if you just have the piston, so it has this on the back, it basically comes out this way. So the piston is going to go in to the pump here so that the handle comes out the back. And your flange is going to screw onto the front. This would be the same with the Medela pumps, and then your bottle is going to be here. So then to do one breast at a time, you pop it on the breast, and you just manually pump. It has lines here for how strong you want the suction. So 4 dots is the strongest and 1 dot is the weakest. So you would twist this here so that the line is on whatever strength you want. So normally you would start on 1 and do your really quick stimulation pulses, and then when you start to see milk flow, you actually twist it all the way and you get a much stronger pump. Another great strategy with this is you do the quick stimulation, and then once you start to see milk, you do pump, 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 and then pump and hold, and then pump, 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 and pump and hold. You'll actually see more milk flow there. How you would do with a single pump. If you want to do it as a double pump, you screw the smiley face on, and you would have the parent wear a hands-free bra. This is going to actually be where you would put the tubing for the breast pump. So you pop one tube here, pop a second tube here that connects to your flanges, and then you can pump both breasts at the same time. So this, I love piston pumps. I think they're just phenomenal products. I always kept one in my pump bag because you never know when you're not going to have electricity, or you're going to be someplace without an outlet, or you forget one pump piece of your regular pump and you're stuck out and about and need to move milk. Great, really small device to manually pump. So this is a piston hand pump. And the next one is your hand pump. So these are what you'll find at Target. You'll find this at your supply stores online. These are hand pumps. Same concept. You put one on the breast and you just use your hands to pump. Most of these, some of these will have different settings to them. So if you look on top, this Lancino, you can actually change. You can make it a softer, quicker stimulation, so it's a little flutter, or you change this on top and now it actually pumps. So by changing the top, you're changing the resistance of how strong or hard the vacuum strength of this pump. So you would start it in that stimulation mode, quick, 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 and then you're changing it into an expression mode. But some of them don't have that. You just do that manually on your own. So some will have like settings to them and some do not. There's also differences in these flanges. So this particular one, that flange is all one piece. So you are limited in the size that you can have on that. You're limited to flange inserts to make this smaller. Whereas this one, the flange comes off, so you could change it out for different flanges. So pros, cons to that. We really can't talk about tools, technology, and devices in the pumping realm without acknowledging double breast pumps. In the United States in 2010, the Affordable Care Act said that insurance companies had to provide a breast pump for breastfeeding families. Prior to 2010, there were really very few pumps that were on the market, and Medela was the most common pump company. It was in the majority of hospitals. Post 2010, there's really been a flood of double electric pumps on the market. Some of them great and some of them horrible. The goal of most pump companies is to try to make a pump that will mimic and imitate how a baby functions and sucks at the breast. So most pumps, based on research, will try to mimic a baby who sucks typically at a rate of 60 cycles or suck bursts per minute. The infant's sucking capacity reaches a maximum negative pressure of about 220 millimeters of mercury. This is based on lots of scientific evidence and research done with ultrasound and manometer technologies. So what breast pump companies are doing is they're trying to hit that capacity, that suction, that vacuum to try to mimic a baby. We want to make the pump work like a baby. Some pump companies will take that in mind and try to make sure that they're having stimulation modes that mimic a non-nutritive suck and expression modes that mimic how a baby actually feeds at the breast. Some will have variations on giving the patient more control over that suction cycle, how fast it goes, and the vacuum, how hard it sucks. And some will have pre-programmed options in them. When you're looking at a good quality double electric pump, you want to make sure that that patient has variability in the cycle speed and in how hard it's sucking to give optimal outputs at the breast. When you're counseling families and picking a double electric pump, we also want to keep in mind that there are some pumps that we would generally recommend to everybody. They are good quality pumps with good motors in them that have appropriate cycles and vacuum speeds on those pumps, and that we know per the research would stimulate the majority of parents well. There are some pumps on the market that will not do as fast of cycles or as strong of suction. There are some parents that will still respond to these pumps, but the majority will not. People who have super sensitive nipples, who trigger letdowns very easily to any device, can use more pumps than someone who actually needs a certain cycle and a certain speed. So keep that in mind, that while I'll have a pump that I recommend for everybody, there's certain pumps that I will only recommend for the select few based on very specific criteria. There are some pumps out there that are just pieces of junk. They are only out there to make a quick buck because they know that there's desperate parents that need to pump for their baby or go back to work. So not every pump is a good pump. Do not fall for the marketing. Help your patients really be discerning when they're picking a pump. And questions to consider would be, how many times a day do you need to use it? How many times a week do you need to use it? How many feedings per day do you need to use it? How many feedings per week? Are you using this after directly breastfeeding to increase supply, or are you using this in place of feeding to be able to feed the baby? So is that family on a triple feeding plan where they're breastfeeding, pumping, and supplementing, or is this only for occasional use? You also want to consider, if it's just random, occasionally I have a date night, you may want to be considering educating on a lower technology product like a hand pump or a piston pump instead of needing a double electric pump. And again, remind families that the body is designed to feed the baby and not feed a freezer. So many parents are using these pumps to create massive milk stashes. And depending on lifestyle, that may be appropriate, but it is not needed. So again, we want to be mindful of how the breast works, how milk is made, the magic number, and breast storage capacity when we're discussing which pump to use. When we're looking at pumps, this is one of the pumps on the market. When most pumps, when you turn them on, should have the ability to do a stimulation phase. It's a very quick, rapid, light suction to stimulate the nipple to tell the body, hey, baby's here, make milk. Then you should have the option to be able to change it over to a much slower cycle with higher or lower vacuums. Okay, so this one now is cycling pretty fast. This is how an older, more mature, full-term healthy newborn would be feeding, whereas a premature or a newborn would be feeding and sucking much slower. So a pump like this has two different modes, a stimulation mode and an expression mode. And in the expression mode, there's variability in the cycle setting to try to mimic the different ages and stages of babies. You have other pumps that do not have that much variability. It basically will have a button that you can toggle back and forth between stimulation and expression, and then increasing or decreasing vacuum. So this has much less customizability for a family to be able to pick their cycle. You'll have other pumps like this. Again, they have different modes. This one has different speed and suction. The more variability that a patient can have, the more control they'll be able to have with that pump. Here's another kind of pump where, again, it's going to give you max variability. So this patient could be able to set the speed per dial. They can change how fast it sucks, and they can change how hard it sucks. Now, just because a pump has good variability to it does not mean that it's a good quality motor on the inside. So when we're talking about a hospital grade pump, it really just means that the milk will never interact with the tubing and potentially get inside the pump, which makes that pump multi-user. It also usually means that it will have good variability in the cycle speeds and in the vacuum. So for instance, this Hygia pump is an open system. So you have the flange at the front, you have the tube in the back, and there's usually a ductbill membrane that generates the suction on the bottom. With this pump, milk goes in here and should come down out the membrane and into the bottle. But the vacuum is here. So there is a potential that milk can go down into that membrane, but then back up and get into the tubing. So this is considered a single user pump and not hospital grade. This is the spectra, and there's no potential way for milk to get into the tubing. So the suction is generated here on this membrane, but when you actually look at the membrane, it's a completely closed system. There's no physical way for milk to get up past this membrane. It might get into this spoke and wheel part, but it can't pass this membrane. So pumps like the Spectra and the Motif Luna are considered multi-user pumps because milk can never interact with the pump, which could ruin the motor or cause mold to grow inside.
Let's also talk about your portable pumps and your wearable pumps. Portable pumps and wearable pumps are smaller pumps that are marketed to be doing pumping on the go. In general, I don't recommend that these be your primary pumps, as they often don't have enough suction capacity or good enough motors to really efficiently empty the breast. In general, now not for everybody, there's always going to be exceptions to that, but in general, these smaller pumps just don't have the same type of suction, the same type of mechanics as a larger pump that plugs into the wall. Oftentimes, the pumps that plug into the wall will have a suction, so they're creating a vacuum with a pull, but they also have some kind of vibration in it to help empty and stimulate that milk. A lot of the larger pumps also have more setting cycles to them, different cycles and speeds, whereas sometimes the smaller pumps don't have as many cycles. They usually have only 2 options for that. Now you have your truly portable pumps, the Medela Freestyle, the Baby Buddha, the Pumpables Genie Advanced. They're smaller pumps that are meant to still hook into tubes to either flanges or collection cups that sit in the bra. So they're portable, meaning you don't have to sit and be plugged into the wall. They're a smaller size that you might clip onto your belt or tuck into a pocket and go about your day. Some of them actually are pretty decent pumps. So the Freestyle, I actually really like this pump. It has a lot of oomph to it. The Baby Buddha is also a very strong pump. Some of these pumps are really great for maintaining milk supply, but usually aren't the best for right out of delivery, for trying to induce lactation, for trying to bring in or increase in milk supply. So they can be great secondary pumps to maintain a fully established supply, but they're not always the best for trying to increase milk or trying to bring milk in. Then you have your truly wearable pumps. The pump is attached to the collection cup and they sit inside the bra to go about your day. You have your Willow 3.0, the Willow Go, and the LV, the original LV, as well as any pump that looks like a square head on the collection cup. This is all done by the same company. They're the same patent, even if they have different names. So the Amani, the Mom Cozy, the Pepita, any of those pumps that look like this with a collection cup, it's all the same pump. They've just branded it differently. The pumps like the Willow 3.0, the Willow Go, the LV that sit in the bra, those have just a straight suction, and depending on the pump, the Willow has a mechanical arm that moves to create that suction, whereas the LV actually pulls the suction through the top. They have a higher risk of mechanical failure from having the suction blocked, and they can actually do some pretty good nipple damage. The length of that tunnel isn't very long. So if you have an elastic nipple where that tissue is really stretching, if you need a different size, some of those pumps can actually be really vigorous and aggressive on the breast and can actually cause trauma and damage. They can also not empty milk efficiently because it is just a straight pull. It pumps differently than a portable pump or your traditional plug into the wall pump. So if you have a parent that's saying they're not emptying efficiently, but they feel like they have trauma or damage, ask what pump they're using. And if it is one of those wearable pumps, make sure that you're doing some education on that. Between the Willow and the LV, those are all hard plastic at the flanges. They approach the breast differently than a traditional flange. So a traditional flange is going to come and hug around the areola and pull the nipple in. Those wearable pumps tend to kind of cup the breast, but they don't have the contour to the breast that a traditional flange does. So you need to be mindful when helping patients pick their pumps that a traditional flange is going to approach the breast differently than a cup that is supposed to come and support the breast. So if you're having a patient with damage from the pump or difficulty emptying to the pump, it may be the collection cup piece or the flange piece that still isn't quite right. The advantage of something like a mom cozy or the Amani is this entire back piece is soft silicone, and the contour is different than the other wearable pumps that have the plastic piece. Your Elvie and your Willow are all plastic, whereas the Amani and the Mom Cozy are nice and soft silicone. I do tend to find that the soft silicone does less damage to the breast and is more comfortable and can empty the breast better than that traditional plastic flange. These pumps do really well for on-the-go pumping. If you have somebody with an established supply that doesn't want to miss a pump, this pump can work really well. You pop it in the bra, they pump, they go about their day, they can collect milk. Know that it might not as efficiently empty as the baby or as a traditional plug into the wall pump, but it does do what it can do. So again, you've got your portable pumps and your wearable pumps. Not every person is going to respond to these, but some people respond really well to them. If you need somebody who just needs to pump on the go, just needs to move milk to maintain their supply, these can be really great options. If you have somebody exclusively pumping, this can help them get in that extra pump to make sure that they're hitting their magic number and moving milk to maintain that supply. Again, not the best pumps for right out of delivery. A lot of people, if they use this as their first pump, it does pull very differently than the baby, and they may get discouraged at the comfort level of some of these pumps. But with an established supply where we're maintaining milk, these can do really quite well for people. You do want to make sure you have the right size flange, either with flange inserts, or some of these do come with different sizes. So those are your wearable and your portable pumps.
Some other things to be mindful of when we're talking about wound care, breast issues, is that I have seen electric pumps cause damage to the breast, often from the wrong size pump flange or not using the settings correctly. So if a patient is using too strong of suction, it can actually be causing trauma to that breast tissue. Flange size is also imperative. If you have a flange that's too large, where too much areola is being sucked into that tunnel, it will swell the areola around the nipple and not let milk empty efficiently. This can run the risk of decreasing milk supply, as that feedback loop is not being told to the breast. And it can also cause issues such as vasospasm, plugged ducts, milk blebs, and mastitis. Anything that pinches that nipple can cause trauma and damage to it. So if you're hearing that a patient has had their second round of mastitis, they've had clogged ducts 5 times, they're feeling vasospasms with these shooting pains in the breast, you really want to know, what pump do you have and what size flanges are you using? Some of the portable pumps also will have alternations in how they cycle. So most pumps will do a nice, gentle, easy, consistent suck. Some of them will do alternating. I have seen pumps, most pumps will pump at the same time, some will alternate, and some have quite an unusual pattern where they may actually do some random cycle speeds to try to stimulate a letdown. That can cause altered sensations for parents. It might not help them let down, and there's other issues that can happen. We also need to consider the overall history of a parent. If there is a surgical history, for example, the breast pump may be able to stimulate milk to be made, but it might not be able to efficiently empty. So if you had a nipple piercing where that hole has scarred shut and there's no ductal opening, if you have some kind of surgery implant to the breast where the nipple is still sensitive, it's still telling the body to make milk, but that milk can't efficiently empty, some kind of breast reduction where tissue has been removed, but it's still being made at the back, we need to be mindful of how we're using these pumps with good quality education, what to expect, signs to look for. So we just really want to be mindful of how we're using our pumps and be really listening to what a patient is saying. Listen for the symptoms, because that will always lead you to the physiology, which then will tell you a lot about anatomy. So when you're educating patients on pumps, you yourself want to do your research of the pumps that are out there. for the best ones that have the most cycle speed, the most variability in the vacuum, that have a really good quality motor and engine, whether that patient needs a multi-user or a single user pump. When you're also considering the portable pumps that just sit inside the bra, the motors are so much smaller. I personally only recommend the portable ones after a full milk supply has been induced and we're maintaining that supply. In general, for most families, you want to recommend that they're using a good quality pump if they're pumping more than once or twice a day, and to only use those portable pumps occasionally to maintain supply, because most people need to pump on them longer and feel that they don't empty them as well as a pump with a better motor or engine to it. Now, that's in general. There will always be exceptions to the pumping wheelhouse. There will always be people that respond better to hand pumps than electric pumps. There will always be people that respond better to hand expression than any kind of technology kind of pump. There will be certain people that respond better to the portable hands-free pumps than the electric pumps. Some people may confound you. They may pump really well to a pump that for the majority of people, you're like, that is a piece of crap. But for that particular person, it works for them. When I'm typically counseling patients about pumps, I will usually say, that is a great pump. It works really well for most. We want to make sure you're using the right size flange to optimize it. And here's how to use their settings. And if a patient walks in with a pump that's on my hit list, I will usually say, we want to make sure that we have a quality pump with the right size flanges to mimic how your baby is feeding. If your pump isn't efficiently emptying you, it can run the risk of decreasing your milk supply. Well, most people find they don't trigger or empty well to this pump. If you yourself feel like it moves your milk well, it triggers letdowns timely, and empties you efficiently of your milk, it may work really well for you. But if at any point in time you're noticing that your milk supply is decreasing without any other factors happening, like sleep training or a tied baby or medications, then it most likely is the pump, and you may want to consider getting a better quality pump. So that's a very basic discussion of some of the pumping technology that is out there on the market, and some ways that you can help counsel your patients when considering those different pumps. We also can't talk about pumps without talking about flanges. In my experience, I have seen the wrong size flange actually contribute to engorgement, plug ducts, and mastitis. When you have the wrong size flange, especially one that's too large, it can swell the areola into the tunnel, which decreases the amount of milk that can empty. So when you have your open nipple pores and the areola is swelling around it, you're pinching off the straw, which can cause not all of the milk ducts to thoroughly and efficiently drain. So that results in edema and swelling around the areola, around that areolar nipple complex, which then doesn't allow all of the milk ducts to drain effectively, which can cause plug ducts and mastitis for some, or dropping milk supply for others over time. So we want to think really wisely about the technology that we're choosing to prevent plug ducts and mastitis, as well as to prevent nipple blebs from, again, pinching and causing inflammation at the nipple tip. And we want to be thinking efficiently of moving milk. So if a parent says to you, when I'm pumping, I started pumping and all of a sudden I started getting plug ducts and mastitis, or my supply dropped, the two issues that you want to look at are, what pump do they have? Do they have a quality pump that's efficiently able to move that milk from a cycle and vacuum perspective? And do they have the right size flange? In my box of tools, I have so many different options because this is not one size fits all. I have found in my experience only about 2 or 3% of people can actually pump with what comes in the box. The vast majority are going to need a different size, a different shape, a different texture. So when you're considering a pump flange, you want to consider the breast shape and size. You want to consider the plasticity or elasticity of the nipple and areolar complex, and you want to consider nipple length, shape, and size. We do not primarily go off of the breast. So if you have a very large breast, you may still need a very small diameter flange. So the actual flange diameter is determined by the nipple diameter and not the breast size. But the breast size and shape may influence which kind or type of flange you pick because of how the angle of that flange relates to the breast. So I'm going to show you a few things in my bag of tricks that I carry with me to every consultation and kind of walk you through my process. So the first would be your standard flange that comes in the box. So if you've worked in a hospital, if you've worked with a Medela pump, this is a Medela 24 millimeter flange. This is also a Medela 24 millimeter flange, but you can see those have very different angles of how the bell meets the tunnel. And they also have different shapes for how they approach the breast. So even though they're the same diameter, this will give you a different pumping experience. This tunnel is also longer than this tunnel, which means you have to have a higher vacuum because you have more negative space in here. You need to have a higher vacuum in order to be able to generate a negative pressure to move the nipple within the tunnel. If you have a longer nipple, this one may be better than this one. So again, choices. Now, this is also a 24 millimeter flange. This is the Lactech Baby Motion flange, and the entire flange is a soft silicone. It also has a panel underneath that massages, so it does some natural compression of the breast while pumping. So if you compare, these are both circles, almost the same diameter, although the Lactech is slightly larger. The actual pitch, this one has a longer cup to it than this one, but this one, the entire cup is soft. Okay, pros, cons, advantages, disadvantages. This one may feel more comfortable for some, but this one may feel more comfortable for others. This is also a 24 millimeter flange. This is the Pump and Pal that completely changes the angle of how it approaches the breast. This is a trumpet, this is a tuba. So this one is actually going to hold back the breast and the areola to allow just the nipple in and out of the tunnel. This is my preferred to start with when you have an elastic nipple, meaning that nipple is hitting the back of the tunnel with the traditional flange. We have super stretchy tissue. This is going to help hold back stretchy areolar tissue. So 24 millimeter flange is completely different pumping experience. Okay, and it's the same with the 21 millimeter flanges. This is a 21 millimeter Medela. This is their Personal Fit Flex that has the soft rim around it, which is different than your Medela without the rim. Okay, and then this is a 21 Lactech. So you're going to have same diameter, soft and flexible, totally different angles. Okay, this is going to be very different for different breasts. So they may need a 21, but they might need a completely different kind of flange. This is also a 21 millimeter. This is a flange insert. It goes into the larger flange. So this is a 24 millimeter Medela flange. This is a 21 millimeter insert. This soft silicone insert goes inside your original flange to shrink down the tunnel. So this 21 millimeter flange will still be a different pump experience than this 21 millimeter flange, even though it's the same company, because of slight differences in the flange. So this one has no flexibility because it's firm plastic. This is a 21 millimeter now, but you have a soft silicone that's actually touching the breast and nipple, and it will do just a little bit of compression while it's pumping. Totally different experience. Now, this is a 21 millimeter, no, take that back. This is a 19 millimeter flange insert that is a soft silicone. This is also a flange insert, but it is a harder silicone, okay? So these will give you two different pump experiences, even if they're in the same diameter. Okay, so one of them is longer, one of them is shorter, this one is firmer. So if you have a very elastic breast where you need to hold back the areola, this could be a good go-to. Whereas if you need more compression of where the areola meets the nipple, this is a better go-to. So think different different options, different textures, different pump experiences. This will fit in most standard pump flanges. So it will fit in to your Medela flanges to shrink the diameter down. This one will fit in your LV, your Willow, your portable pumps. So this, you can see the stem length is different. So if a parent wants this one on a portable pump, they often need to trim the bottom so that it doesn't block the intake valve in the portable pump, whereas this one can just pop in and it won't block the intake valve. Other pump flange options, this is just a comfort ring that goes around most of your standard flanges to make it just a little more comfortable on the breast. So if the parent is having red rings around the breast, most likely they're pushing it on too tight with their pumping bra, but they can use something like this, which is a pump cushion for the end of the flange. Other newer products on the market, this is a breast pump cushion that fits into the flange. So again, it's a jelly. So it's a silicone kind of jelly-like flange. That's basically the similar concept. It's going to do more massage for a little more comfort. So all kinds of different flanges. So I will bring all of these on a pump consultation. We can usually get a pretty good idea of nipple diameter and start there. I have had patients where we try 4 different size 21s and only one feels comfortable. And I have other patients where we try a 17, 19, and 21 and they all feel comfortable. So what we're looking for is the 3 F's of flange fit. So 5 F's, flange fit. So I'm looking for fit. I want only nipple in and out of the tunnel, where we're not getting rubbing and we're not having too much space. We want feel. It should feel comfortable with no blanching, no vasospasms that are happening from it, where it feels comfortable during and after pumping, and it should function, meaning it empties milk efficiently. If the parent reports they still feel like they have milk, or they're having those signs of recurrent plug ducts and mastitis, it's not functioning well. We also want to make sure that these flanges aren't causing vasospasm. So one of the most overdiagnosed breast issue is thrush. I have routinely seen that misdiagnosed when it's a vasospasm being caused by the wrong size pump flange. So if you have too big of a flange, you have to crank that section up to generate enough negative pressure in the tunnel to efficiently move that breast tissue in the flange, which then causes the areola to swell around the nipple, which does a vasoconstriction, which when you then release that, blood vessels can now return to normal and it causes the vasospasm. So if I'm getting what I consider recurrent thrush or symptoms of thrush, white nipples, blanching of nipples, burning, tingling, shards of glass sensation in the nipple, and the parent is pumping, I'm always looking to that pump flange first to make sure that we have the correct size flange. So when you're considering fitting patients with their pumps, make sure that you are also assessing for the correct flange size, because it is not one size fits all. What works for one patient will not work for all. And every once in a while, there will be a patient that defies everything that you know to be true. So most of the time, I'm going smaller. Most of my patients need a 17, 18, or 19 millimeter flange. The smallest I have put someone in is a 10 millimeter, one person. I've put one person in a 13 and about 5 or 6 in a 15. The majority, hundreds of patients now in my practice need a 17, 18, or 19. And then I've had handfuls of 21s. I've put 16 people in a 24 millimeter flange and 4 in a 28. This is based on my geographical area. There are people in other countries, other geographical areas where the people they're working with have larger nipples, so it is based on anatomy. Now, typically in my experience, people need to go smaller. We want just areola in and out of that tunnel, but it should meet the criteria of the 3 F's, fit, function, and feel. If it fits well, but is not functioning, you need to play around with finding a different size to make it work. So I've had 1 or 2 patients where the nipple was very tiny, but it was unusually shaped, Or in hand expression, we had to express way higher up on the breast than I normally anticipate. So we don't want to express at the nipple. We want to be expressing behind the nipple on the areola. But every once in a while, where those lactiferous sinuses are, where that breast triggers the release of milk is different. It's anatomy. It's going to be very person to person. So every once in a while, I'll have a very small nipple that we actually do need a larger pump flange on to be able to make it work. Now, I'll often hear, well, in the hospital, I felt more comfortable going bigger. We also have to consider where in the process of lactation we are when choosing our pump flanges. When you have a very enlarged, engorged, fluid-filled breast in the immediate days and weeks postpartum, that will respond differently than 3 to 6 months down the road when all of that vascular congestion has been reabsorbed, the extra blood and fluid in the breast that are there to help make milk have been reabsorbed, where the breast is back at pre-pregnancy size, swelling is gone, we no longer have that engorgement and fullness to help keep a full breast. We now have a pancakey mom breast, a soft, flat breast where the tissue just doesn't have that bulk behind it. That's a very different pump experience, right? So while they may have been fit for a larger size and it fit and worked for them in hospital in the immediate days and weeks postpartum, usually that will end up sabotaging the supply later down the lactation chain because of the natural changes of the breast. So usually if I have a patient that was doing just fine on a large flange, I'm then educating that was for that time in your lactation journey, as we talked about all those changes in the breast. And now you're at a new stage of development. And so we want to make sure that we're correctly resizing, refitting that flange to make sure that we're not then creating breast issues later on. And the biggest breast issues that I'm seeing are recurrent plug ducts, which then cause mastitis and or vasospasm. So those are all my flange fit ideas and thoughts, and I hope you found that helpful.